Hello again, and thanks for listening. Today I'm here in the Munson Medical Center Microbiology Lab with two of our talented leaders, Ann Gore, our lead technologist, and Aaron Mills, one of our medical technologists. We're here in this department where they do an amazing job of diagnosing and treating and helping work with our physicians around infectious disease. We have an exciting development with some new equipment that we just put in place, and Aaron's going to talk to us a little bit about what this new equipment is and what it does for us.
The new piece of equipment is the MALDI-TOF, and MALDI-TOF stands for Matrix Assisted Laser Desorption Ionization Time of Flight.
Easy for you to say.
And it is a mass spectrometer that aids in the rapid identification of bacteria and yeast. Previously, it would take us anywhere between 2 to 3 days to identify microorganisms. With the MALDI-TOF, we cut it down to about under an hour.
Wow.
How the MALDI-TOF works is just taking a single bacterial isolate and putting it on one of our target slides that we have, and we put a matrix on it. When we put that on the instrument, there is a laser that hits the sample well, and that will cause the matrix to ionize the sample. There is an extraction plate in the instrument, and that will cause the acceleration of the ions to go through the flight tube, and that's where it starts all the peaks and the binning and the identification of the microorganism.
Well, that's great, Aaron. Thanks. And why don't you tell us a little bit about what this means for our patients?
This is actually a revolutionary product. Previously, we took 2 to 3 days to identify bacteria, sometimes a little longer, and bacteria identification is incredibly important for therapy. If you know the identification of a bacteria, you can actually target the therapy and put the patient on a specific antibiotic versus broad-spectrum antibiotics. Broad-spectrum antibiotics contribute to different diseases.
Yeah.
C. difficile is a very widely known one,
Right.
causes severe implications in the patient.
Yeah. So it really helps us target our treatment, and which is great for our patients. And I know this is no small project to get it up and running, and in fact, you guys have said that it oftentimes takes a year or more from the time we get this equipment until it's actually up and running, right?
It does. It takes at least a year. Most hospitals have had this instrumentation for about a year, a lot of research facilities.
Yep.
I had some excellent help from our IS team.
Yep.
That's one of the major holdups, but they did a fantastic job helping me out with getting this thing up and going.
And so Aaron and you and the team here got it up how quickly?
It was a month and a half.
Wow.
We installed the
Wow.
instrument, got it up, got
Yeah.
it running.
So this is exciting. We are really on the leading edge with this technology, and it cost about $280,000, right?
It did.
That was a project that our foundation adopted, and I want to say a big thank you to our donors who made this possible. We couldn't do these kinds of leading edge technologies without the support of charitable giving, so a big thank you to all those who made this possible. And thanks to you and all your team for the great work that you're doing here in the lab.